راح نحكي الآن عن other papulosquamous conditions which are mainly pityriasis rosea and lichen planus. Slide 2 شايفين عندي different groups of papulosquamous conditions. All of those conditions are characterized by having scales, papules, plaques. راح نختار first of all pityriasis rosea. pityriasis rosea بالعربي بسموها النخالية الوردية. pityriasis في عليها يعني fine scales. rosea it has a rose color, red. The cause of this pityriasis rosea هي عبارة عن reactive skin condition characterized by having large patch that appears after a sore throat. الكوز تبع sore throat هو عبارة عن human herpes virus type 7 and 8. فالبيشنت will have sore throat like symptoms with cough, low grade fever. Few days later ببلش عنده reaction في the skin. The condition is not contagious, usually appears at early autumn and springtime. Usually it's seen in children and young adults زي ما احنا شايفين slide number 6. First of all, after the sore throat a few days بظهر عندي large black أو patch بسموه herald أو mother black. Usually it's about 2 to 5 centimeter in diameter. هاي black لها well defined margin في عليها fine scales وهاي السكيلز جاية على المارجن وفيها red in color. differential لهاي الليجن is fungal infection. كيف نعرف انه fungal infection او لا؟ bedside test بسموه ايش؟ skin scraping مع KOH preparation. بنعمل scraping للسكيلز نحط على سلاين نحط عليها KOH. We look under the microscope we can't see anything. There are no hyphae or spores. ليش؟ Because it's simply not a fungal infection. هي عبارة reactive condition appears on the skin due to sore throat caused by human herpes virus type 7 and 8. Few days later after the appearance of this mother patch بظهر عندي similar lesion smaller in size had the same characteristic features. هي عبارة عن plaques أو patches the Christmas tree pattern محل lines of the ribs على الباك والtrunk. It might appear بالthighs بالupper limbs but not below the knees or above the neck area. Lesions بيكونوا more scaly, round, smaller in size. 50% of patients might develop severe itching and burning sensation. Of course, about condition, it's a self-limiting condition. Usually, it stays from 2 to 12 weeks. Sometimes it disappears from the skin and leaves something called post-inflammatory hyperpigmentation. يعني تيجي الانفلاميشن صار بالسكن الانفلاميشن cytokines release بالسكن activates melanocytes which are responsible for the production of melanin. Melanocytes are seen in the basal cell layers. Once they activated they produce more pigment. فبالتالي once the condition disappears from the skin the patient end with having multiple small hyperpigmented patches. Patches, flat lesions more than 0.5 centimeter in diameter without depth. It involves change in the color or structure of the skin زي ما حكينا definition تبعها المحاضرة الأولى. فالديفرنشال diagnosis للهيرالد بلاك زي ما حكينا تينيا كوربوريس هي fungal infection في الترنك. تينيا اللي هي fungal infection كوربوريس كلمة لاتينية للترنك معناها ترنك في اللاتيني. other differential guttate psoriasis زي ما حكينا guttate psoriasis تكون في pediatric age group salmon pink in color عليها thick silver scales. It appears after streptococcal infection. ايش يمكن نعمل blood test لهذا البيشنت نعمل ASO titer اذا كان هاي معناتها most likely sore throat was due to group A beta hemolytic streptococcal infection. differential الثاني secondary syphilis مش مطلوب منها حاليا. differential الثالث بترياسيس versicolor. بترياسيس versicolor هي عبارة عن ايش؟ multiple skin patches brown in color عليها fine scales and wrinkles. It's usually due to something called Pityrosporum ovale. هي عبارة عن normal flora موجودة على السكين yeast. Overgrowth of this yeast gives pityriasis verticaler. راح نحكي عنها بالfungal infection lecture. Sometimes pityriasis rosea might be induced by medication. زي antiepileptics, penicillamine, oral isotretinoin used for severe acne, gold, captopril. Usually, if it's induced by medication, it stays more than 3 months and becomes eczematous with time. Sometimes vaccination might induce pityriasis rosea-like picture. فسلايد نمبر 12 شايفين differential diagnosis groups موجود عندي. فالصورة الأولى على الشمال it's pityriasis rosea. ليش؟ كان لي sore throat. A few days later the patient developed the herald patch of plaque. It has well-defined margin عليها fine scales. على المارجن few days later the patient developed similar lesions, smaller in size, more scaly على trunk area in a Christmas tree-like pattern. differential تاني تينيا corporis شايفين كيف؟ black هاي بالصورة بالسنتر black fine scales على المارجن و centrally clear. Pityriasis versicolor usually it appears as multiple brown wrinkly patches. هاي brown wrinkly patches caused by yeast called Pityrosporum or Baculari أو Pityrosporum oval على بترو أو ملازيزيا فرفر. كل هاي الأشياء has the same name. يعني نفس المايكرو اورجانيزم بسموها ملازيزيا فرفر وهي نفسها بتروسبورم اوفال أو بتروسبورم اوربيكولاري. ف once it's active it's called brown wrinkly patches. Once it's not active the patient might end up with multiple small white patches. ليش؟ لأنه اليست هاي بترياسيس فيرزيكولار اليست بتعمل لي بترياسيس فيرزيكولار produces dicarboxylic acid natural acid inhibits the activity of melanocytes. So once the lesions disappear from the skin the patient might end up with post-inflammatory hypopigmentation. differential تاعت guttate psoriasis زي ما حكينا difference between guttate psoriasis وال guttate psoriasis appears after group A بيتهم streptococcal infection بالثروت. لما بنعمل ASO titer ما في عندي هون هيرالد باتش أو بلاك. عندي multiple papules and plaques red in color salmon pink عليهم thick silvery scales. Investigation there's no need for an investigation. إذا شاك fungal infection لازم أعمل skin scraping and KOH preparation. Secondary syphilis let's forget about it as differential at this stage. بالنسبة treatment there's no treatment. It's self-limiting condition. It's a reactive condition to a sore throat. So there's no need for any treatment. Treatment usually is symptomatic. If the patient has itching, burning sensation, we give moisturizer creams. اللي بيسموها كريمات مرطبة. Sometimes we might give topical steroid or antihistamine. Sun exposure might be helpful sometimes as it's immune suppressant. Suppresses the immune activity of the skin which has caused the reaction. نروح الآن على اللايكن بلينس. لايكن بلينس بالعربي بيسموه الحزاز المنبسط. الحزاز المنبسط. It's chronic inflammatory condition of the skin. It's not contagious. It has been associated with hepatitis B. شو الكوز تبعه؟ It's not known. It's immune mediated condition in a genetically susceptible patient. أنا في عندي skin involvement, في عندي oral involvement, nail and hair. So it's a systemic condition. Lichen planus affects the skin, mucous membrane, nail and hair. Sometimes it can be induced by external factors such as medication. As it's autoimmune condition, it can be associated sometimes with alopecia areata, vitiligo, ulcerative colitis. الكوز تبعه انه في عندي destruction للديرموبيديرمال junction cells. The basal cells, and this is usually by CD8 cytotoxic reaction. This cytotoxic reaction sometimes can be induced by hepatitis C infection, by drugs such as beta blockers, AC inhibitors. فلما يصير في عندي damage في البيزل سيلز، بيزل سيلز فيها كيراتينوسايتس وفي عندي ميلانوسايتس، فبتوقع الميلانين اللي موجود في الميلانوسايتس will be disrupted, will get out of melanocytes, بعدين it drops deep down in the dermis by a process called melanin incontinence. ففي عندي multiple variants for lichen planus. الاتروفيك annular bullous follicular ulcerative. مش مطلوب نعرف كل هاي الفاريانت، اهم شيء نعرف ايش البابيولار variant اللي هي most common type. فالبابيولار variant of lichen planus characterized by something called 6Ps. البرايمال ليجن papule أو plaque. It has a polygonal margin. polygonal يعني مضلعة. planar surface يعني surface is smooth and wide. مش papule ما لها dumb shaped appearance. It's a planus. الكلر تبعه purplish. It's a pruritic, very itchy. typical lesions ال 5 P's أو 6 P's appears على flexural aspect of the upper limbs زي ما احنا شايفين بسلايد 24 as multiple papules. لو نعمل TSAD primary lesion is papule elevated skin lesion less than 0.5. Sometimes you might see plaques elevated skin lesion more than 0.5 centimeter in diameter. هاي التي color تبعها purplish surface. It has a rough surface with whitish streaks white lines على surface. margin it has well defined margin. arrangement ما في specific arrangement. distribution جاي وين على flexural aspect of the upper limbs. على whitish streaks الموجودة على purplish papules بسموها Wickham striae. Wickham striae. بالنسبة لسلايد 25 زي ما حكينا lichen planus not only involves the skin it involves mucous membrane hair ونيل. في الميوكس membranes بنشوف multiple small dot and lines white in color. هاي بسموهم ايش؟ Wickham striae. Wickham striae. Those lesions are usually asymptomatic and there is no need for those spots. Those spots has been associated with hepatitis C infection and dental filling اللي هو بسموه amalgam حشوات الأسنان القديمة اللي فيها سيلفر عفوا فيها جولد ومغنيسيوم وكوبر. Lichen planus might affect the genital area and might cause some erosions at the genital area. Sometimes you might see phimosis in uncircumscribed men. Sorry, in uncircumcised patient. طبعا ulcerative form of lichen planus might increase the risk of squamous cell carcinoma, usually seen in genital area and on the feet. هلا زي ما حكينا السورايسيس في ريسك انه يصير عندي كوبنر فينومينا. كمان هاي الكوبنر فينومينا seen usually in lichen planus. So Koebner phenomenon is not specific for psoriasis. زي ما حكينا it can be seen vitiligo, viral warts, lichen planus, Kaposi sarcoma. The course of the condition usually it's chronic. The eruption usually stays from 1 to 2 years. بعد هيك تقريبا up to 13% of patients might have recurrence. The nails might be affected in about 10% of patients with lichen planus. زي ما حكينا المين باثولوجي في اللايكن planus minimal inflammation and damage في البيزل سيل لاير. فهون ما عندي اوفر جروث او هايبر بروليفريشن زي ما عندي بالسورايسيس. هون المين باثولوجي involves CD8 mediated cytotoxicity and damage to the basal cells. والبيزل سيلز ايش موجود فيها؟ موجود عندي ميلانوسايتس وموجود ستيم سيلز. فلما يصير في damage في الستيم سيلز we might end up with scar formation. خاصة إذا صار عندي lichen planus بالنيل أو بالهير I might end up with scarring changes بالهير أو بالنيل. That's why إذا في عندي lichen planus بالنيل أو بالهير this is indication for systemic immunosuppressant treatment. Topical immunosuppressant just like topical steroids is usually not helpful to control the condition. Why? Because the condition affects the stem cell and causes damage to the stem cells which are usually seen at the basal cell layer. كمان نفس الشيء بالنسبة للhair follicles. So I might end up with scarring hair loss. The most common changes موجود في اللايكن planus بالnails is nail thinning. ما في عندي nail thickening أو subangular hyperkeratosis زي السورايسيس. لما حكينا الباثولوجي هون involves damage للبasal cell layer in which stem cells are there. The stem cells هاي بالnail matrix are responsible for the protection of the nail plate. لما يصير في damage راح يصير في thinning للnail plate. بينما بالسورايسيس في عندي inflammation بس ما عندي damage في البasal cell layer لا عندي proliferation overgrowth of cells. cells are hyper proliferating they are rapidly dividing فأتوقع يكون في thickening في النيل because the cells are overgrowing. So as a rule of thumb أي lichen planus بالنيل أو بالhair is indication for systemic immunosuppressants. زي ما حكينا ulcerative form of lichen planus can be a risk for squamous cell carcinoma. differential diagnosis في شيء بسموه lichenoid drug eruption. شو يعني؟ عبارة عن skin reaction usually appears after taking some sort of medications زي beta blockers, antimalarial, non-steroidals, thiazides, penicillamine. If the patient took one of those medications, they might end up with a rash on the skin similar to lichen planus. So those are the medications that can exacerbate or induce lichen planus. عشان هيك بالهيستوري مهم جدا نسأل عن drug history في اللايكن planus. مهم جدا نسأل عن blood transfusion to rule out hepatitis C, which is usually associated with oral lichen planus. Differential تاني lichen planus discoid eczema أو discoid lupus. زي ما حكينا discoid eczema appears in the upper limbs أو lower limbs بكون well defined margin بس في عندي eczematous eczematous types of scales which are fine, adherent, blunt, gray all over the area. وفي عندي excoriation أو erosions على السيرفيس that is scratching of the skin. وفي عندي lichenification. الأورال lichen planus if it's inside the mouth differential diagnosis بيكون oral candidiasis. Can be a differential diagnosis for oral lichen planus. ولكن إذا عملنا scraping للcandidiasis I will end up with some sort of erosions بالمouth. بينما lichen planus إذا عملنا scraping we can't see anything. diagnosis من خلال بيوبسي. على changes موجودين في البيوبسي مش كتير مهم نعرفها. ما أتوقع نجيب عليها أسئلة نهائيا. بس بنعرف إنه في عندي damage في البيزل سيل لاير. damage في البيزل سيل لاير. This is very important for the treatment. خاصة عندي lichen planus زي ما حكينا بالنيل أو بالهير. Treatment can be difficult. Is it self-limiting? Most of the time it can be self-limiting condition. So if it involves only the skin in a local area, I need to give super potent topical steroid. ليش؟ عشان في inflammation بالskin, I need to suppress this inflammation, and this is usually done by topical steroid. Lichen planus, if it affects the oral mucosa, if it affects the face or the groin, I should not use super potent steroid in those areas. ليش؟ حكينا في risk of atrophy, thinning, telangiectasia, abnormal hair growth على الفيس. I need to give steroid sparing agent اللي حكينا عنه بالسورايسيس دو calcineurin enzyme inhibitor tacrolimus أو pimecrolimus. Oral steroid can be given if the patient is having lichen planus over large surface body area. I can't give topical steroid on daily basis for up to 4 weeks. I need huge amounts, so I'll shift the patient on oral steroids for about 4-6 weeks, and then I'll taper the oral steroids. If there's recurrence, I should not use steroids alone, otherwise the patient might develop major side effects like obesity, hypertension, diabetes, osteoporosis. So I need to give steroid sparing agent just like methotrexate, azathioprine, mycophenolate mofetil, sometimes oral acitretin, the oral retinoid can be given, and sometimes phototherapy might be helpful. لكن زي ما حكينا في عندي involvement بالnail أو بالhair, then go for oral immune suppressant. Phototherapy can be an option زي ما حكينا. Cyclosporin, antihistamines might be helpful only for itching but doesn't have any immune suppressant action. زي ما حكينا if any mucous membrane involvement without any symptoms there's no need for treatment even for the genital area. ولكن ulcerative form of lichen planus need to be treated. ليش؟ لأنه في risk of malignancy من هذا الفورم. We can use topical steroid, calcineurin enzyme inhibitor, and oral immunosuppressant. This is the end of this seminar. If you have any questions, please ask me.